Here's something wild. Norovirus, one of the main culprits behind the stomach flu, can survive on hard surfaces for days, and it's resistant to a lot of cleaning agents. Hello, everyone. Welcome back to Reem Healthcast. Today, we're talking about something most of us have experienced at least once in our lives: stomach flu. So, what exactly is the stomach flu? Is it actually related to the regular flu we hear about every winter?
So let's break this down. The stomach flu, or viral gastroenteritis, is caused by viruses like norovirus or rotavirus. It's not the same as the seasonal flu, which affects your respiratory system. This one targets your stomach and intestines, and the symptoms hit fast: nausea, vomiting, diarrhea, stomach cramps, and sometimes a low-grade fever. On the other hand, normal flu comes with fever, cough, and sore throat.
And if you've ever had stomach flu, you know how miserable it can be. Nausea, vomiting, diarrhea. It can completely knock you out of your routine for a few days.
Think about how many surfaces we touch in a day: doorknobs, phones, countertops. It's like the virus is just waiting for someone to slip up. And that's why the stomach flu spreads so easily. It's not just about direct contact with someone who's sick, it's also about all the invisible ways the virus lingers. You touch a contaminated surface, rub your eyes or grab a snack, and boom, you're down for the count.
So, once those symptoms start, how long does it usually take for someone to recover?
And those symptoms can knock you out for a couple of days. What's worse is how quickly it spreads. If one person in a household gets it, chances are everyone else will too.
If you had to guess, where do most stomach flu outbreaks begin?
Schools and daycares are like breeding grounds for these viruses. Kids touch everything, share toys, and don't always wash their hands as thoroughly as they should.
So, when children catch stomach flu, what should parents be most worried about?
When kids get it, dehydration becomes a major concern. They lose fluid so quickly through vomiting and diarrhea, and they might not be able to communicate how thirsty they are. Parents really need to watch for signs like fewer wet diapers, dry lips, or unusual drowsiness.
And it makes you wonder, right? If surfaces can carry the virus, what about the food we eat?
And it's not just surfaces. Contaminated food and water are huge factors too. If someone preparing your food didn't wash their hands properly after using the bathroom, you could end up with a nasty case of viral gastroenteritis. It's not like you can always tell. The person might not even be showing symptoms anymore, but could still be shedding the virus. That's the sneaky part. It's contagious even after people think they're in the clear.
But sometimes it's hard to tell if it's really the stomach flu or something else. Food poisoning, for example, can look very similar. True?
Absolutely. Food poisoning is usually caused by bacteria like Salmonella or E. coli, and the symptoms can start within hours of eating something contaminated. It often affects just the person who ate that specific meal, unlike the stomach flu, which spreads more widely. And then there's irritable bowel syndrome, or IBS. That's a chronic condition, not an infection, but the symptoms, bloating, abdominal pain, gas, can mimic the stomach flu. The difference is that IBS isn't contagious and tends to flare up due to stress or certain foods. And let's not forget about acid reflux. It can cause nausea and discomfort after meals, but it doesn't come with the fever or diarrhea you'd see with the stomach flu. Or food intolerances like lactose intolerance or gluten sensitivity. Those can cause cramping, bloating, and diarrhea, but the symptoms are usually tied to specific foods and don't spread to others. Another situation where people sometimes get confused is early pregnancy. Morning sickness, nausea, and vomiting is very common in the first trimester. It can sometimes feel similar to a mild stomach virus, but it typically doesn't come with fever or diarrhea. And then there are more serious conditions like Crohn's disease or ulcerative colitis. Those are chronic immune-related issues that require medical management. They're not something that will resolve on their own like the stomach flu often does.
So, when should someone see a doctor? Because most cases of stomach flu can be managed at home, but there are definitely situations where medical attention is necessary.
For starters, if you can't keep fluids down for more than 24 hours, that's a big red flag. Also, if you see blood in your stool or vomit, or if symptoms last more than 3 days, it's time to consult a doctor. And for kids, signs of dehydration, like dry lips or very few wet diapers, are a clear signal to seek help.
So, when someone actually has the stomach flu, what does treatment look like? Is there any quick cure?
Not really, there's no instant cure for stomach flu, but supportive care can help your body recover faster. The focus is really on managing symptoms and giving your body the time it needs to fight the infection. And speaking of fluids, hydration is key when you're dealing with the stomach flu. Vomiting and diarrhea can deplete your body's fluids quickly, so sipping water, clear broths, or electrolyte drinks is essential. But you've got to take it slow, especially if you're feeling nauseous. Small sips are better than trying to gulp down a whole glass of water at once. And once you can tolerate fluids, you can start reintroducing food.
And when it comes to food, what are the safest things to start with?
Stick to bland, easy to digest foods at first. The brat diet, bananas, rice, applesauce, and toast, plain oatmeal or porridge, plain boiled pasta or broth based soup with soft noodles, is a classic for a reason. It's gentle on your stomach and helps you ease back into eating. Just avoid anything greasy, spicy, or high in fiber until your stomach settles. But you should always check with a doctor, especially for kids, or if you have other health conditions.
So, let's talk about prevention because, honestly, avoiding the stomach flu in the first place is the best case scenario. What are some of the top tips?
Well, hand washing is number one. It sounds simple, but washing your hands with soap, especially after using the bathroom or before eating, can drastically reduce your risk. And disinfecting surfaces, things like kitchen counters, toys, and remote controls, can help too. And if someone in your household is sick, try to avoid close contact with them. Don't share food, drinks, or utensils, and keep them isolated as much as possible until they're symptom free for at least 48 hours. Yeah, for parents, getting your kids vaccinated against rotavirus is another effective prevention measure. It's not a cure all, but it can significantly reduce the severity of symptoms if they do get sick. That vaccine has been a game changer for reducing severe stomach flu cases in kids. But even with all these precautions, sometimes it's unavoidable. If you do catch it, the key is to rest, stay hydrated, and give your body time to recover. And don't rush back to work or school too soon. You're still contagious for a while, even if you're feeling better. Staying home until you're symptom free for at least 48 hours is crucial for preventing the spread.
So, to sum it up, the stomach flu is no joke. But with the right care and precautions, you can recover safely and minimize the risk of spreading it to others. And if symptoms persist or you're worried about dehydration, don't hesitate to see a doctor.
Absolutely. It's all about listening to your body, taking it easy, and staying vigilant with hygiene. Hopefully, this helps anyone out there who's dealing with or trying to avoid the stomach flu.
Thank you for joining us on Reem Healthcast. We hope this conversation helped you better understand stomach flu. Stay tuned for our next episode, where we continue bringing you practical, easy to understand health topics. Until then, take care and stay healthy.